When arthritis develops, one or more of these structures become damaged or inflamed. As a result, movement becomes painful, stiffness develops, and over time the joint may lose some of its normal function. But here's the part many people miss. Arthritis is not always just old age or simple wear and tear. The type of arthritis matters because the right treatment depends on the real cause. In today's video, we'll explain what arthritis really is, why it develops, and the different types you should know about. To understand arthritis, it helps to know how a healthy joint works. The ends of your bones are covered with a smooth tissue called cartilage. This cartilage acts like a cushion, allowing bones to move smoothly without rubbing against each other. The joint is also lined by a thin membrane called the synovium, which produces fluid to lubricate and nourish the joint. When arthritis develops, one or more of these structures become damaged or inflamed. As a result, movement becomes painful, stiffness develops, and over time, the joint may lose some of its normal function. One of the most common forms of arthritis is osteoarthritis. This is often described as wear and tear arthritis because the cartilage gradually breaks down over many years. As the cartilage becomes thinner, the bones begin to rub against each other, causing pain, stiffness, and reduced movement. Osteoarthritis most commonly affects the knees, hips, hands, and spine. Although age increases the risk, it is not caused by aging alone. Previous joint injuries, excess body weight, and repeated stress on the joints can all contribute to its development. Another important type is rheumatoid arthritis. Unlike osteoarthritis, this is an autoimmune disease. Instead of protecting the body, the immune system mistakenly attacks the lining of the joints, leading to inflammation, swelling, warmth, and pain. If left untreated, rheumatoid arthritis can permanently damage joints and may even affect other parts of the body, including the eyes, lungs, and heart. Early diagnosis and treatment are especially important because modern medicines can slow the disease and reduce long-term damage. Gout is another common form of arthritis, but it develops for a completely different reason. It occurs when uric acid levels become too high, allowing sharp crystals to form inside a joint. These crystals trigger sudden attacks of severe pain, redness, swelling, and tenderness. The joint at the base of the big toe is the most frequently affected, although gout can involve the ankles, knees, wrists, or elbows as well. Without proper treatment, gout attacks may become more frequent and eventually damage the joints. Some people with the skin condition psoriasis may also develop psoriatic arthritis. This inflammatory form of arthritis can affect both the skin and the joints. It may cause swollen fingers or toes, joint pain, stiffness, and changes in the nails. Early treatment is important to prevent lasting joint damage. Although symptoms vary depending on the type of arthritis, several warning signs are common. Persistent joint pain is usually the first symptom people notice. Morning stiffness lasting longer than 30 minutes, especially if it improves with movement, may suggest inflammatory arthritis. Swelling, warmth, redness around a joint, difficulty moving normally, reduced grip strength, or pain that continues for weeks rather than days should never be ignored. Some people also experience fatigue, particularly with inflammatory forms such as rheumatoid arthritis. A family history of certain types of arthritis can increase risk. Previous joint injuries, obesity, repetitive physical stress at work or during sport, smoking, and some autoimmune conditions also play important roles. For gout, elevated uric acid levels are the main cause, although genetics, diet, kidney disease, and certain medications may contribute. Diagnosing arthritis involves much more than simply asking where the pain is. Your doctor will usually begin with a detailed medical history and physical examination, looking for swelling, tenderness, reduced movement, and patterns that suggest a particular type of arthritis. Depending on your symptoms, investigations may include blood tests, X-rays, ultrasound scans, or MRI scans. These tests help identify the type of arthritis and guide the most appropriate treatment plan. Treatment depends entirely on the type and severity of arthritis. Pain-relieving medicines and anti-inflammatory medications may help control symptoms. People with rheumatoid arthritis or psoriatic arthritis often require specialized medicines that target the immune system to reduce inflammation and protect the joints from permanent damage. Physiotherapy is another important part of treatment because it helps maintain strength, flexibility, and joint function. In severe cases where a joint has been badly damaged, joint replacement surgery may restore movement and significantly improve quality of life. Lifestyle choices also make a real difference. Regular low-impact exercise, such as walking, cycling, swimming, or gentle strength training, helps keep joints flexible and muscles strong. Maintaining a healthy body weight reduces pressure on weight-bearing joints like the knees and hips. Eating a balanced diet supports overall health, although no single food can cure arthritis. Smokers are strongly encouraged to quit because smoking increases the risk and severity of rheumatoid arthritis and can reduce the effectiveness of some treatments. It is equally important to know when medical advice should be sought without delay. If a joint becomes suddenly swollen, extremely painful, red, and hot, particularly if you also have a fever, urgent medical assessment is needed because a serious joint infection must be ruled out. Likewise, persistent joint swelling, pain lasting several weeks, or increasing difficulty with everyday activities should always be discussed with a healthcare professional rather than dismissed as simply getting older. Arthritis can be a lifelong condition, but it does not have to define your future. With an accurate diagnosis, appropriate treatment, regular physical activity, and healthy lifestyle choices, many people continue to work, remain active, and enjoy a good quality of life. The earlier arthritis is recognized, the greater the opportunity to reduce pain, protect the joints, and maintain independence for years to come. Listening to your body and seeking medical advice early may be one of the most important decisions you make for your long-term joint health.